You can see we're now on our middle of our combination acne scar treatment, doing the deep laser CO2 to get her improvement in her scars. And although this laser is really strong, the deep doesn't hurt as bad as the more superficial one because it's doing a lower density and the laser beams are much smaller within millimeters of dots, which is why it's hard for you to see. But here we are covering the entire area where she has deeper pores and larger scars. Turn your head a little more to the right. We've done microneedling, radiofrequency plus filler, and now we're working on the deep laser. And we're gonna do the entire surface in a second with the more superficial CO2. Remember, for larger scars and more intense scarring, we need a more strong treatment like an ablative laser. And that's what we're doing here. Perfect. Like that. Okay, so you guys can renumb the cheeks.
While we switch hand pieces, can you tell us about the post-care for such a strong laser?
So now we're going to switch. We're going to put a little more numbing on. We're going to take off the forehead. You're going to numb here. The aftercare is extremely important, you guys. You have to do our post-procedural protocol. Stem cell products, peptides, all from emercosmetics.com. My new botanical serum, which helps you heal much more quickly. And also masks and red light. Very, very important. The other thing is you're going to get all these scabs and crusts. I'm going to cover everything. And it's going to need exfoliation. So enzyme peels, enzyme exfoliation, really important while you're healing. Oxygen is really important. So we basically are going to do all of that in her post-procedural care. Right now they're putting a little more numbing to those areas we just treated, and now we're going to go and treat starting at the forehead, because this area numbs the easiest, with our more superficial active laser. If you guys are getting this treatment done elsewhere, you can go to emercosmetics.com and you can get a virtual consultation for skincare, and we can give you our protocol. If you want to just get the protocol, you can go to the ablative laser package. Okay. So now, set that up.
Rescue patient, how are you feeling so far?
Not bad. I can't talk, sorry, not too bad.
Not too bad, guys.
That was the first part on a 1 to 10.
Oh, see, it's a 4.
Not bad.
That's not.
Pretty low.
We're going to do our test pulse. Perfect. So you can see the density and the strength. And we're going to start on the forehead now. Okay, you're going to feel this a little bit in the middle. But as we move out, you'll feel much less. And now we're doing a higher density. So this she'll feel a little more in some instances. The forehead's a lot less than the rest of the face. That's why I do this first. I let the numbing sort of kick in a little bit more in the cheeks. Doing really great. What are they saying there?
Not too many comments
Okay,
yet,
good.
more viewers than comments.
So it's really important you feather the outside. You doing okay? Okay.
Is it good for pock marks and other acne scars?
Yes, remember you guys, I did a whole TikTok and reel the other day about monkeypox scars and why this would be helpful in doing lasers. So yes, you can do lasers for any type of scarring. Tell them how to make that appointment.
Guys, if you want an appointment, send us a DM, full name, email, phone number, or you can go to our website. You can reach out on there. You can get an appointment with Dr. Emer, or you can get an appointment with our facial plastic surgeon, Dr. Sandin. Over here, guys.
Yes. So now we're working, it's halfway done with the forehead already, which is really good. It's really
And
tough.
while we have both doctors here, can we talk about combining lasers and facial plastic surgery?
Very important, you guys, to get the best result when you do facial surgery. It's really important to do lasers at the same time. Not only do you have the same recovery, But in some instances, if you use fat grafting with stem cells or you do any injectables with collagen production, like a Sculptra during a facelift, the lasers will stimulate that collagen and help the skin tighten even more. Also, it helps remove the scars. Any scars that are being produced from the surgery, lasers can be used really early on to get a nice softening of those scars much more quickly and a better long-term result. Turn to the right for me. Perfect. So we're really following a very patterned area.
Someone said, that's great. I'm in New York City, guys. We go there too. We'll be there September 21st.
So yeah, if you want to do a CO2 in New York, make your consult right away because we are going to be coming there in 3 or 4 weeks and we would need to do your pre-treatment now.
And spots are getting very limited for that trip. So make sure you guys
We're in
consult now.
a new office.
New office, quite a bit bigger if you guys remember our old office.
It's going to be very fun. You're doing great. You're doing
For those of
really
you that are
great.
there, guys, we are going to be offering facial plastic surgery as well. So rhinos, blessed. If you guys want to get a consult, you guys can come see Dr. Sanin.
You're going to feel this little one here.
Like you there in New York too at some point soon.
That's what we're
So
saying.
you guys, come see him.
Yeah, very soon. So let's get those consults going so we can plan into the year. That would be great. So you guys see, we're really working in a more superficial area. Now don't let the laser fool you. Even though it looks like not a lot is happening, a significant amount is happening. This is a very high level fractional, very strong.
For those of you guys who are very concerned about how she's healing, how she looks days after,
You're doing great.
we'll be
You're
showing you
almost there.
updates on our stories, and then we'll publish a final one at the very end, a recap of her whole healing process and her treatment.
We're going over that deep area. Really good. So this is a painful procedure. Remember on live last week, a girl cried. I felt really bad, but she looks amazing now.
She does, guys. We'll show you that. I might even see if I have that on hand right now.
And I like to tell people, like to be honest, like some people are a lot better with pain. There is nerve blocks, there is pills, but some people are just more sensitive and there's only the best we can do. Now you could go to sleep if you wanted, but most people are able to tolerate it pretty well.
Someone in New York is currently doing Clear and Brilliant, but they're unsure if it's for their pockmarks or they're wasting their time.
Yeah, Clear and Brilliant won't treat that, guys. I'm sorry. I would suggest you come see me.
We can do something a little bit stronger, do a different laser, maybe
It
a
might be a
combination
good
of treatments.
maintenance, but not your long term for the deep scars. Do that consult with us right away.
And we'll definitely want to send you skincare ahead of time, get a treatment plan, book your appointment. We don't do any in-person consultations in New York. We confirm everything ahead of time with you guys.
Yes.
And if you're thinking that you need a body consult with us, you guys can do a virtual. And if you're a good candidate, you can do an in-person consult
Almost
in
done
New
with
York.
the right now. Only the left to go. Okay, so that right side's done now. We're going to turn her to the right. She's doing really good. I know it's painful, but we're basically at the end of the line. She's doing it. She's motivated to get that good result. So even though it doesn't look like a lot has occurred in the cheek area from the deep, that's because, again, low density, very deep.
You guys will see the difference in that area as she peels and scabs up over the next few days.
And we're going to start to hurt a little by your ear. Just going to feel this part a little bit. There's less nerves here. Again, really following a pattern. And I wouldn't suggest just watching my videos and starting to do this.
So providers, guys, if you're going to think about watching the videos and do it, Dr. Emer does offer training. If your provider is interested in that, send us a DM. We'll get you connected and we can schedule a training at any one of our locations.
We do a lot of trainings in New York. People will shadow and we'll do some demo patients end of day. The fun part with the training is we can go to dinner that night. Dinner is always the fun part.
Does
Right.
this clear up the skin?
What'd you say?
My heart was like racing.
You know it's from the lidocaine. Honestly, you'll be okay. It'll go down soon. Just take deep breaths through your mouth. So she was saying that her heart is racing, which is from the lidocaine. She's also very thin. Thinner women tend to react a little bit more to the lidocaine, which will go away in 1 or 2 hours. I actually am crazy. You know what it makes me do? Pee. I know it sounds crazy, but can't do that. It makes me have to go to the bathroom. My heart rate goes crazy and I have to pee. But it will go away. She'll be okay. We're gonna get that cold air on her in a second. That tends to calm it down for some reason.
Can we get an Emer skin mask? Can we call it in?
What?
Should be a hydration mask.
Almost done. Almost done. We're doing great. I also added that extra lidocaine. That's also probably why, but it really makes a difference. Turn this way with the pain. Otherwise, it would be really painful. We have 2 more minutes on this side, then of the nose. We're almost done.
Oh, sorry, didn't grab you or anything.
Alright, just gonna kind of fill in a little bit here. And we have a really great goggle here. Video optic goggle. That's protecting her eyes.
Someone said adding Emerage and
Okay.
Phytomask after.
Yes,
Because we
that's
love
what we're
adding
gonna
that.
do.
So say, is this for textural improvement? Yes, this is for textural improvement. We can also use it for anti-aging and skin rejuvenation purposes.
Botanical serum is really important even immediately. We're doing the hydration masks once or twice a day at least for the next 5 to 7 days would be great as she's peeling. It'll help her heal. There's tea tree in there that also helps decrease, is antibacterial, helps decrease any risk of infection. Okay, turn this way. We're doing the other half of her nose. Almost there. 1 minute. We're done.
You know, the ending part right now, ending on the nose.
Okay. So now I'm just looking to make sure everything's filled in properly. Here. Feathering the edges, make sure everything's perfect. Okay, so
We've got a lot of people on here for Jason Emer Official.
give her the cold air. Let me take this off you. Hold on a second. Lay back. I'm gonna give you the cold air also, okay? I'm gonna leave you through. Now, I'm gonna put on a little bit of medicine, keep the cold air. Blow that on your face. Get the botanical.
And I'll have it.
So one of the things we do afterwards, you guys, created these products on purpose. We have many providers using them now. Let's take the is the botanical serum, which is made of vitamin C, hyaluronic acid, green tea, and other botanical ingredients to help her calm her skin down. I'm going to put that on first. You're going to get really wet, okay? You're going to get really wet right
Rosa,
now.
we have people asking about in Spanish. Can you tell what we're doing? Yeah, people, it sounds like they're asking what we're doing in
You can get
Spanish.
this at MirageCosmetics.com. Can you tell them what the PRP is in Spanish?
El PRP es un plasma que se saca directamente de tu sangre, después se centrifuga y es el PRP, es tu plasma de tu propia sangre, como el facial de vampiro que le llaman. Nosotros lo usamos más para las propiedades para la piel que se regenere.
Thank you.
Now, plasma helps combine with the peptides that are in our mask. Peptides also have, there's green tea in here and hyaluronic acid, tea tree, and all their calming agents. So I'm going to take all that serum and I'm just going to pour that on right now. It's going to get her really cold, and it's going to help her again calm the skin down. It's okay if it drips all over. Don't worry, they'll get it. Although you did wear a killer shirt, love it. And there's some extra serum in here, so when you do this as a provider, save a little bit extra and let them take that home. Use it later that night, put it in the fridge. We're gonna put the mask on right after the PRP, and it's gonna help the botanical serum and the PRP get into the skin better. And then she can relax the best we can. Okay. Hold on. Move you up. There you are. Good, deep, slow, deep breath. Okay, now lift her up, and that should be good. So that is it, using the Emer Skin Hydration Mask, botanical, she did really well. Sometimes the lidocaine can help increase your heart rate. It makes her feel like it's more difficult to breathe because you can't open and close your mouth well. So we're just leading her forward. She'll relax a little bit, she'll be fine within